either where I'm at, or if you want to like maintain your body as you get older, like you want to maybe like create these habits as you're younger, right?
Everything kind of that I was hitting in the gym, kind of squats, deadlifts, everything like that. Just making sure that I was kind of building up my weight over time. And I think the really important thing,
if you set the right habits now, you will set yourself for success into your 30s, 40s, and 50s.
I don't know if that's like probably the best testimonial I can give you, because I think that's something that it can't be kind of given. It's something that you really have to you have to learn it on your own and experience it.
All right, welcome in, guys, to another episode. I'm Dr. Jason Wan, orthopedic physical therapist, and today I have one of my clients here, Jacob. Jacob, me and him met in the Bay Area, and I think he was referred here by another client that I was working with, and it's been truly a privilege to see him grow, see his progress and transform, and I think that he'll be probably the best person to speak about some of the things that he was struggling with, some of the things that he's tried, and ultimately what was some of the main factors that actually led him to success. And I think some of the things that he hit on that he wanted to really speak about was, one, about consistency, and two, about progressive overload. So if you don't know what those things are, well, consistency is something that you know, but if progressive overload is something that you want to learn more about, something that can help you to transform your health, improve your pain levels, stick around, because we have a lot to uncover. So Jacob, I genuinely appreciate you being here. So how are you doing, man?
I'm doing well. Appreciate you having me on.
Yes, thank you so much. So yeah, Jacob, why don't we first talk about just, a little bit about your background, so who you are, what you do, and what are some of the things and what are some of the health related things that you were struggling with when we first started?
Yeah, for sure. So I'm 27 years old, work as an urban planner, and I came to Jay, I guess, about 6 to 8 months ago at this point. But I've had two kind of hip arthroscopic surgeries that are fixed labral repairs. The first was about 5 years ago, and the second was about 3 years ago, and they both led to some improvements, but kind of the rehab never got me back to where I wanted to be in terms of kind of fully active, biking, running, hiking, doing the things I love to do. And it led to a lot of kind of compensatory injuries in terms of back pain and knee pain, even foot pain. And so I realized that kind of I just had never gotten past the point of clamshells and kind of my PT exercises. I needed to learn how to really take care of my body and strengthen my body, and came to Jay. A friend kind of recommended him who had a really good experience, and thought it would be kind of a good way to get me back on the right track.
Awesome. Yeah. So that's a great background. So I mean, with the arthroscopic hip surgeries that you had, what were some of these specific, I guess, like movement limitations that you were having, or was it more like just, a lot of times it's like more sedentary based, or like sometimes prolonged sitting? So yeah, just kind of explain some of the more triggering factors that were hindering you.
Yeah. So yeah, before the surgeries, it was kind of sitting for more than an hour, got to the point of being really uncomfortable. Any kind of impact, so things like running, jumping, were really uncomfortable. But then even after the surgery, kind of the rotation of the hip, so internal, external rotation, really were limited. And then I think I just learned how to really protect that part of my body, but didn't really feel comfortable working through the pain. And I think that was a key part of our work together, in terms of kind of learning how to push through, understand that some pain is okay, and then learn how to push through that, in order to kind of regain some of that mobility and flexibility that I had lost for a number of years.
Yeah, for sure. So, what were I mean, so with regards to physical therapy and some other treatments, so obviously, two surgeries. With regards to like the rehab, whether it was prehab or even like post surgery, how was your overall experience there? And do you mind sharing about just, yeah, some of the interventions? What kind of stuck with you? Why do you feel like maybe some of it didn't work for you specifically?
Yeah. So I mean, I'd always heard like surgery should be your last resort, and so before the first surgery, I thought I tried everything. I did at least a year of PT. I did a lot of dry needling. I did acupuncture. I did cupping. I did massage. I did, I think, everything I could get my hands on. But I think the piece I probably didn't hit was like true strength training, and that just kind of didn't feel like it was something out there from the PTs I was seeing. And so it was really much more focused on kind of banded resistance, which is useful, but I think never allowed me to kind of build up the necessary strength in the muscles that had weakened over time. And yeah, I think with the second surgery, I probably moved a little bit more quickly. I probably didn't even exhaust all my options. I did did PT, did the dry needling, but was kind of like, okay, this kind of worked the first time. Let me try it again. But I don't know. Yeah, surgery is expensive. The recovery is grueling. And I think I'm an example that I'm better, but I'm not as much better as I think the surgeons promise. So yeah, if I were to do it again, I probably would have tried a little bit harder, especially with the second hip.
Yeah. Well, I mean, surgery and injections are all different types of interventions. I wouldn't even deem them, whether it was like, positive, negative. I think most parts of healthcare are trying to leave a positive outcome on their clients' lives. Otherwise, why would they be in the profession? But at the same time, I think some don't really set really strong expectations on, again, what we talked about is like consistency and progressive overload and strength training. I think that consistency trumps everything. I think I've said that on multiple podcasts already, how I think that consistency amongst the many aspects of exercise and the things that you can learn in physical therapy, the most important is consistency, which is something I feel like I hit on really, really hard from the get-go with you. Even before we even started working together, it's like, if you're not consistent, we might as well not even start. But if you are going to be consistent and you are willing to learn the things that I can teach you, consistency will win over everything, which hopefully, since obviously we're no longer working together, but you're here, is that you're still maintaining that level of consistency. Progressive overload, really, really, really critical, because there's much more merit and there's a lot more value and significance to overloading the tissues that accompany your hip and some of the areas that we were able to resolve together. If you're not really working those tissues around the joints, biologically speaking, you can do as much of the passive manual treatments out there that are going to give you some, I guess, some temporary relief. But if you're not using that as a window of opportunity to load your body up more, then you're really not going to get back to your functional goals. So that's why I always say that, like, doing passive treatments is not going to lead to active goals, right? You have to pair up passive with active. So with all that said, would you feel that, I mean, just going back to your experience with physical therapy, do you feel that you were absolutely consistent at that at those times? And do you feel that because you weren't really seeing the results with like the banded, let's say, clamshells and all those things that I said that I rarely promote them, especially for a 27-year-old athlete? Yeah, do you feel like it was consistency was a factor, or do you feel like it was more just the kind of the treatments that were given to you?
Yeah, I think I was reasonably consistent with it, but at the end of the day, I just never really saw that much improvement. And I think it was kind of like, I don't know if this is an analogy you gave me or heard from someone else, but like you're on this hamster wheel. If you're just like going around and around, you get a little bit more, but you're never able to kind of talk to get off the hamster wheel of like being independent and on your own. And yeah, I think it was kind of like, okay, I'm going to go 2 times a week and I'm going to do my exercises and I'll do them twice at home. Um, but it's like at the end of the day, it's not getting me to where I want to be. And it's more like I'm checking a box so that I can then go get surgery, which is kind of how it felt like the surgeons talked to me and treated me, is like, okay, this is the only solution. And then if you're going to go this path to make sure you meet the insurance requirements, we're going to have to do PT. You have to check this box, you're going to get your injection. But the goal isn't really like seeing if you can avoid surgery. It's more just like, these are the prerequisites so you can get surgery. And yeah,
Yeah.
someone that didn't, I think at this point, I'm much more knowledgeable about the healthcare industry. But when I was 22 and this first happened, I was like, okay, like a doctor with an MD is telling me this is the way to go. I guess this is what I have to do. And then the surgery is going to get it better, and kind of get me out of this hole that I'm in. So yeah, no, it was alarming, to be fresh out of college and having to go through this. But
Right.
yeah, that was my experience.
Yeah, and I mean, it's totally fine. I guess what's done is done, and it's part of
Mhm.
your journey that you've been on, and I'm glad that you're much
Yeah.
better as a result of it. Surgery is it's not a panacea for everyone. Surgery are going to have various outcomes for people, and also it depends on your mindset as well. So regardless of the surgery, nobody should think that they're damaged goods, leading into surgery. I also think that surgery is a product of your beliefs. So if you do feel that it's really going to genuinely help you, then a lot of times that can spring you into the actions necessary to get past that surgery. A lot of times, if you're going into surgery with with either negligence or I guess thinking that it's going to maybe even go into a thing like I think it's going to help me, but you're coming into it with a little bit of doubt and uncertainty and skepticism, then
Yeah.
actually that might actually lead you to a negative outcome. So now that you've now that you've had obviously have been through that, do you feel, before we dive into like our treatments and what we've done, which I think is going to be super valuable for people, did you have any expectations going into the surgery? Was there any fears, uncertainties, doubts, pre or post surgery? I'm just curious in your end, because mindset and your emotions, that plays a lot into the overall experience of in your health journey too.
Totally. No, and I would totally agree with what you just said of kind of like you have to, before you go into surgery, you have to be 100% in, because it's a traumatic event you're putting your body through, and kind of you have to do all your prehab, and then you have to be fully committed to the rehab. And so I think with both cases, I was committed to, especially after the first one, I kind of knew what I was getting into myself with the second one, and kind of prepared accordingly, prepared with my job, and kind of got my PTs in order. And yeah, I think the rehab, I just didn't love my physical therapist the second time around as much as I did my first time. And I think that's such a big part of it. I think the surgeon's key, but I think the physical therapy is probably equally, if not more important. And so, yeah, I think if that was one kind of thing that was just like a stressor, we didn't get along as well. And I
Mm,
didn't kind of feel like I had the level of trust that I had. And I think that's kind of such a big key part is you really need to feel like they understand what you're going through. But yeah, I think as long as you're mentally committed to, mentally aware of what you're going to be going through, I think that's such a key part that surgeons don't really talk to you about is like the mental just stress of that event.
mm.
And that's just something, it's like a learned experience. I don't know how else kind of to speak about it.
It's all right. I mean, you talked about trust, and that's a huge piece. I think the two words that come to mind when I work with any client is trust, as well as a therapeutic alliance. The alliance is the fact that if you feel like my goals are not aligned with your goals, then you're not going to trust me, right? And that's why I always kind
Mhm.
of do a consultation to see if we're a good fit, right? At the same time, really understand that if your goals don't mesh with mine, or if your expectations are either underwhelming or far beyond what I can give to you, then I would say I wouldn't even start working with you. But do you, so with regards to how we were able to interact and do things, did you did you find that as even from the first session, did you find that there was a level of either accountability, trust, communication? Like, did you feel like a lot of those were kind of hitting the mark, or was it kind of like as we kept going, then you started to kind of gain that trust? Because I know that you going through many things. There's somehow there's walls, right? There's
Sure.
sometimes mental walls of like trusting people. I'm just curious on your end about when we first started, how you kind of felt.
Yeah, I mean, I think I remember from our first, so we had kind of an online consultation, just like a call. And I think the first thing I remember was just feeling like you, almost like a sense of just like empathy from you, and that you, I don't remember, I know you've also kind of gone through plenty of injuries yourself, but either from those personally or just from all of your work, it felt like we were speaking the same language, which is a bigger deal to me than it might sound. But I think just having had these experiences over the past few years, it's like being able to really just feel like I'm understood felt really important right away. But yeah, I would definitely say it takes time to kind of build trust and actually get starting to work out and get in the gym together. But I think that was the first sign that was like, okay, this is something that could work, because it just feels like you actually understand what I'm saying to you,
Yeah.
which is really important to me to start.
Yeah. I think one point of like where I really felt that I could help you was the fact that when you said you had the two surgeries, like, oh yeah, well, like just literally a few months ago, I was working with somebody with the same exact hip,
Mhm.
the same exact surgeries,
Yeah.
and he had two as well, and I was like, dude, if like a 40 something year old dad who has many obligations and he's older can make huge differences. I'm like, you're 20, you're 26, 27-year old. I'm like, you're
Yeah.
probably going to do better if anything. So I think that was a huge point that gave me a lot of confidence, but I think also, yeah, it instilled confidence in you. So yeah, let's hit on let's hit on the stuff that you learned. Obviously, I think that's really important. So the education, even from the first session, what were some of the key takeaways? I know it's a while back, but what were some of the key takeaways right from the first session that you felt like you really learned the most? So just talk about even just in general, your first session and how that kind of went.
Yeah, yeah. So I mean, I came to you with kind of these fears that like my body felt like it was broken, right? I just moved to the Bay Area from Colorado maybe 2 months before, and yeah, from the move or whatever it was, kind of my back was in a bad spot. I had this kind of plantar fasciitis pain. The hips were a problem, and I think the first thing that we really talked about was just like you need to learn how to load your body with weight. And yeah, I know that we keep getting back to kind of just this resistance training, but like learning how to your tissues and your kind of tendons need to learn how to really handle weight if you're going to get serious about doing big backpacking trips, if you're going to go skiing again, if you're going to learn how to kind of play sports again. And I think that was the biggest thing, and it applies to everything. And I think about it every time I'm in the gym now. Is kind of like you need to think about progressively increasing the weight that you're putting your body under, and do it slowly because you're going to get hurt otherwise. And I think, yeah, we had setbacks in our time working together, but I think that was the biggest thing that I learned right away that's kind of really stayed with me, is just learning how to like put your body under weight so it can adapt to real life kind of circumstances really well.
Yeah, the big words are like capacity. So just you understand that like when we first started, capacity, just like I think like a Duracell battery, a capacity is it has a specific amount, and at some point, if you try to surpass that capacity, you blow up the battery or you have setbacks and flare ups. And that was a huge piece too. Is understanding, and maybe we didn't like set that expectation, but I was like, hey, there's so many clients that I work with where if they make a mistake in their training, it's it's not the fault of the exercise, but it's the fault of the person that either overloaded themselves too quickly, right? So like too much too soon, if you will. And sometimes when you have those setbacks, sure, there could be doubts and uncertainties, but at the same time, I'm always like, you got to learn from your mistakes. I am
Mhm.
not somebody that has the perfect even for me, after doing this for 10 years, working out over 18 years, I still make mistakes in the gym
Mhm.
and I still will flare up things. But at the same time, it's like that is literally a part of learning. I mean, everyone makes mistakes with their relationships, mistakes with their finances, and in the same light, Jacob, as you know, is that you probably have left our last session and probably have hit some hurdles, right? Have had some inklings of discomfort. But at the same time, it's like you've built up your capacity so much so that compared to the first session, you're tolerating 200 plus pounds with either deadlifts or squats. And obviously, that's a much better place to be, right? It's just being empowered that
Yeah.
even despite pain, I mean, you can easily kind of get past it with the right strategies. Consistency. So, what is it? I mean, we don't have to define that, but why was that so important during our time working together?
Yeah, I think, I mean, what I've learned is just that like that's the only way you're going to see any progress, right? So I mean, with these rehab, the prehab and the rehab, it's hard to be consistent because after one session you're not going to see any improvement, and I think mentally it's hard to kind of trust that you're going to get anywhere because it takes time, and I think really learning to be patient with your body. And for me, I just gone through so many years and so many different specialists and treatments that it was hard to like trust. But I think that goes back to how we started with the beginning. It's just like trusting that this is the process you need to commit to, and if you're consistent, you're going to see improvements, and like they will come. And it took time, right? Like I think after my first week, no, I didn't see anything. After the first 2 weeks, I didn't see anything. But it's like trusting that things will improve, and I could feel myself getting stronger, and I could feel my back, getting more mobile and opening up for the first time. And yeah, and like over time, you do see the results you really want. For me, it was kind of being able to get on my bike and riding it for 2 hours in a way I hadn't done in literally years. And that was kind of the biggest part of my life before the surgeries. And so I think that's you will see markers that really mark the progress, but I think just like trusting that you really need to be consistent was the biggest thing for me. And yeah, I
Mhm.
think that was like, I mean, with your, I think one, like we obviously had the session showing up, but you were incredible about checking in and kind of, hey, I saw that you were at the gym today, kind of like let me know how it went. And I think that's the accountability that really came with the treatment that kind of enabled the consistency to happen, and that you have a little you have another layer outside of just yourself. because it can be hard. You have your job, you have all your other responsibilities, but
Right.
to have someone else, in your messages a few times a week being like, how did the treatment go, is really made a difference, I think, for me.
Yeah, I was gonna ask you that follow-up question, and the question I was gonna ask was like, what enabled you to build that trust? Because so many people can go through one session. I mean, I always say that the first session from my end, from my perspective, is really critical because if, for example, let's say on the first session I gave you the wrong treatment or the wrong exercises, and you just like flared yourself up and you were lying in bed, like what makes you think you would want to come back to the second session, right? You'd be asking for like a refund, but um, that's actually true. That's what I think about is like really gaining the trust right from the get go. So besides, I guess the ongoing communication, or maybe like when I saw you log a workout, maybe I congratulated you or say like, hey, let's keep it going. Anything outside of that accountability that really enabled you to build that trust from the first and second session? And I ask that because it is really critical for sometimes to build that alliance right from the get go. Outside of those check-ins, was there anything else that kind of allowed you to build that trust?
Yeah, I think the communication was probably the most important piece, and then outside of that, yeah, I mean, I think just starting to see the progress enabled me to kind of to build it, and yeah, I think that you take a slight leap of faith, right, and kind of committing to the training, and I mean, I think for me, it's like if I'm financially committing to this, I really want to take it seriously and make sure I'm being consistent to see results. And so I think that was a part for me. Is like I'm investing my own money in this. I want to and it's I want to make sure there's a clear kind of line to how I'm doing, and I think that helped me take it even more seriously.
Mhm.
Versus if I'm like going to PT all the time, I'm investing probably more money in PT than we did in our training. But there's
Mhm.
like less of a there isn't the accountability in PT that I feel like we had together, which is I think the most important piece for me.
Got it. Yeah. Besides me keeping you accountable, was there any differences as far as the type of program that I did set for you? I try my best to pride myself in building very like more robust or very contextual type of exercises. I have a platform and app that I feel, gives people a good sense of like video demonstrations and
Mhm.
putting stuff on the calendar. Or maybe, I know you're pretty techie yourself. So like putting it into your own Google or Apple calendar. So
Yeah.
like, yeah, what's the experience of just having it's not really like I'm not asking you to rate the app, but in terms of like the way that I set things up and the way that you were able to follow through with it, was there any value to that compared to maybe other PTs?
Yeah, I don't you asked not to rate the app, but I would say I love the app. I think the app made it incredibly easy for me to follow along. There were a lot of time, not a lot of times, but there were a few times where the gym I go to didn't have the equipment that I needed. And so in those cases, quick to be like, hey, try this instead. But at the same time, the app also has a lot of different suggestions for like, hey, you want to hit your adductors and you don't have the adductor machine, like, hey, try this instead. And so I think the app made it incredibly easy. It kind of sends me pings when I should be working out. It allows me to just kind of like really hold myself accountable. And I think it obviously communicates with you too. So you're kind of able to track the progress. So no, I don't know. I think that's a phenomenal tool that you have, and it allows you to kind of really in real time update workouts, and kind of I think it allows us to communicate very easily with each other too.
Besides the app, which that is a part of the consistency, because I always feel like if it's in your schedule, there's a saying I think by like Stephen Covey, it's like you either schedule your priorities or prioritize your schedule. So that means that if you schedule your priorities and like you schedule in these workouts, they will happen, right? But if you prioritize your super busy time strap schedule, who isn't time strapped nowadays? But if you prioritize that, then you're prioritizing everything else besides the fitness, right? You're prioritizing the chores, the dates, or even your job or other means. So what with regards to the consistency outside of the app, was there any other strategies or things that you kind of employed, even just to kind of make like mobility a habit, or when you're at work, was there anything that you specifically employed or things that I taught you, which I know it's been a while, but
Sure.
how were you able to stay brutally consistent even outside the app? Was there any strategies that you employed?
Yeah, I think for me, just like when we started working together, I was like, this is I thought I took my recovery and training seriously, but I like realized in retrospect I just didn't. And so it's like, okay, we're going to be in the gym. I think you had me in there kind of 4 times probably a week, and that was kind of the split that we worked out. But it was kind of like you need to be doing these other things at least 2 to 3 times a day. And I'm like, oh come on, like that's crazy. Like you want me foam rolling my back all the time? You want me doing all these like hip openers and things like that? But it's like, yeah, you do. Like I'm sitting in this chair 7 hours a day at my desk, kind of working. And it's like, okay, if you're going to be serious about then getting on a bike where you're kind of in this same hunched position, you have to treat your body better. And I think that just like something finally clicked for me, and that like, okay, I'm not old, but like my body will break down if you don't start treating it better. Um, and I think that message just takes a long time for someone still in their 20s to kind of sink in. But I think I've
Mhm.
just had enough repeated experiences that like you have to be consistent, and kind of I think the mobility is key of just these 10-minute workouts that you do 2 or 3 times a day, to just keep your back, keep your legs, keep them kind of like looser and more opened up. And I think again, it's like over time you will see the progress and see the results. And I think that's that's the easiest way to kind of be consistent with this. Because if you don't see progress, it's hard to keep wanting to do things. But I think just being consistent that first month and getting, I think us from the first to the second session and kind of already being able to kind of, I think, trust the process we were on, allowed me to kind of really buy in from there.
Now that I think about it, I do recall like the first and second session. I wouldn't say there was pushback, but there's always a sense of me like trying to lead by example. So when I told you, hey, like this is what I do, and then you're like, okay, let me see what you do. I was like, let me show you my formal routine. But I told you like I do this 8 to 10 times a day, and you're like, is that even necessary? I'm like, well, if I don't want my body to break down, that's the necessary preventative things that I do. And it's really up to you if you want to follow suit. Right. And I'm like, you are younger by a good
Mhm.
7, 8 years. But if I'm really consistent at my age, it's like if you want to be either where I'm at, or if you want to like maintain your body as you get older, like you want to maybe like create these habits as you're younger, right? Speaking to people in their 20s, it's like, oh, 20s, there's a lot of people, even your age are like, oh yeah, I can get away with certain things, right? And I'm like, no, like if you set the right habits now, you will set yourself for success into your 30s, 40s, and 50s, right? So I'm really glad that you're like, even outside the gym, if you're going to be sitting on your ass for 8 to 10 hours, it's like you can afford 20 to 30 minutes of
Mhm.
mobility at work, right? And if you don't, then then you are working backwards essentially. You work for every hour that you sit, it's like body can get stiff again. So you need to supply it with something that will allow you to get out of those stiff points. Otherwise, that's where people can incur more arthritic changes, or the joints can get stiff. And then, if you think that you can just make it all up at nighttime, or make it up on the weekends, that is how literally people get injured, is thinking that 40, 50 hours of sitting, your body's going to be completely okay by the weekend. So I'm glad that you, hopefully, even today, you're still hitting on those same points, right? Maybe have the foam roll or something close by to your
Yeah.
desk.
Yeah.
That's good. It's good to hear. All right, let's hit on progressive overload. So, I guess you can teach me back. So, like, what exactly is progressive overload, and how were you able to employ that, throughout our time working together?
Yeah. I didn't know we were going to do a little pop quiz. Uh,
Let's
no,
share your
yeah. I think
definition.
for me, progressive overload is kind of learning how to add weight onto your muscles gradually, kind of through your training up until the point of kind of failure. And so building up slowly and then kind of pulling back a little bit, um, and inherently doing that kind of progressively, gradually over time. And yeah, I think we applied that to everything in the training. Obviously, everything kind of that I was hitting in the gym, kind of squats, deadlifts, everything like that. Um, just making sure that I was kind of building up my weight over time. And I think the really important thing, we've touched on consistency, but I think the tracking was really important too, and something I'd never done previously, before. And so, kind of making sure I'm being really good about how many sets, how many reps, and kind of really drill down to how much weight I'm doing, because I think that's the only way to really see my progress over time. Previously in the gym, I would just go in and say, okay, I think I had 35s last time. Let me do this again. But actually tracking and seeing my progress, I think I was able to get stronger a lot more quickly, because I was actually kind of being intentional about what I was doing in there.
Yeah. I always compare this to finances. So if you're not tracking your finances, then you don't know what money's coming in, what money's coming out, and then you end up in a negative cash flow. You end up in debt, or you get or you get in trouble with the IRS. And in the same light with finances, is fitness is just as important. Um, Fitness in terms of, if you're not seeing what you did the week before, then what makes you think that you're going to progress the week after, right? You got to progress something, whether it's volume, which is holding your plank longer, or it's adding on a couple extra reps. Every time it's just going into the gym, understanding that you need to become 1% better. And another point we kind of hit on was um, understanding what failure feels like. I think there's a lot of nuance in this industry around, do you need to hit failure? Is failure even important? Do you need to feel soreness the next day? And my take with you for sure, Jake, was like, if you have all these athletic endeavors, not pushing to contractile failure is a mistake. Going into the gym just thinking you can half-ass it, that's a mistake. Not logging workouts, and not logging workouts the rest of your life, I really think that's a mistake that I think 90% of gym goers, or people that even go to the gym, they make that mistake. I think I showed you my data. I'm like, I have data from like 10 years ago, and that allows me to make justifiable decisions on what I need to be doing in the gym today. Right. So, um, with, with, in terms of that, I know that the app really helped as well. Being able to kind of see what you did from week to week. So with regards to, in relation to the progressive overload, what changes were you seeing as far as like how you felt on the day to day, and also getting even back to the activities that you wanted to do? How did progressive overload kind of translate into that?
Yeah, yeah. I mean, I think the first week I really remember being like, I think we had 2 leg days that first week, and I was like, I can't get up and down the stairs. And it's like, I'd never trained really legs consistently in my life. And we're like, okay, no, like that's good. You have to really push. I think learning how to push through the initial soreness was a
There's
little bit
a
of a
mental hurdle
mental
there.
block I had to get
Yeah.
through. But I think that was a big deal. I think right at the start, was getting through that. But then from there, it's like, yeah, learning how to kind of understand what kind of soreness is good for your body, versus if there's anything that kind of you're like, okay, this is something that, like, hey, let's check in, this doesn't feel right, my knee is doing something that it shouldn't be doing. But yeah, I think like learning how to push yourself a little bit harder each day, but then also really learn how to recover well. We really talked a lot about the nutrition, making sure kind of you're getting enough hydration, sleep, protein, those things, so that your body is staying sore to recover, but not staying stored longer than it kind of really should be. So I think that's also a piece. I know we didn't kind of focus too much on nutrition, but I think just like getting that information really dialed and making sure I was kind of hitting these marks of how much, just like the right kinds of food I need to be getting into my body, and really sleep, I think is something I probably prioritized more than I had previously as well.
Yeah. I know we didn't hit on nutrition a lot, but obviously you have my contact, so we'll have future conversations about that, and we'll definitely keep in touch. Um, the the points of consistency and progressive overload are the ones that we hit on the most, just because I felt like that was needed in order for you to maybe overcome either your fears and uncertainties with um, your body in the future, and also just making sure that you have kind of a plan of attack where you can continue things on long term. So maybe that's just one thing I want to hit on for some people that are listening to this is, um, I guess there are certain practitioners that want to fixate you to the treatment. I think it's a part of the business model at times. Like when you start your own practice, it's like, how can I, how can I keep the client, in my care? But I told you from the get-go that I didn't want to teach you everything that I know so that you can continue this on long term on your own. What is your thoughts about the word autonomy and independence? Do you feel like that's something that you gained during our time working together?
100, like 1,000%. I think the thing that's kind of been bouncing in my head as we've been talking is like, I think the mental health component is probably one of the pieces that's been most improved through our time working together. And I think that directly is kind of attributable to the independence and autonomy that I've gained. Right. Like my body is still not perfect. I think it's going to be a process for the rest of my life. There are days where I'm like, I'm in pain again. Kind of, I'm like having a little bit of a mental breakdown and kind of what's going on. But I remember now that it's like, okay, you have to do your mobility, get back in the gym, and like be consistent about what you have to do. And that's done more for me than kind of all these other practitioners that I've seen, including the surgeries that I've done over time. And yeah, I think there's like just a direct connection between feeling like, okay, I'm actually the owner of this body, even though it's not perfect. I'm the owner of it, and I'm in charge of kind of being able to get it better. And that's, I don't know if that's like that's probably the best testimonial I can give you, because I think that's something that it can't be kind of given. It's something that you really have to like you have to learn it on your own and experience it through the consistency. But kind of being able to feel that way in your own body again is something I'd lost as a result of these surgeries. And like, even though I'm not perfect again, and I'm still, it's kind of a work in progress, I'm so grateful to kind of have that piece back.
Yeah. There's a quote that I use, which like perfect inaction, you know, like perfect inaction is never going to supersede like imperfect action, right? So like you saying that your body's not perfect. I'm glad that you're admitting that. I'm glad that you still can admit to people that are listening to this that despite the successes that you've seen mentally, physically, from a mental standpoint, no longer in a state of fear, physically much stronger than you were before. I think where we left off is you're lifting like 200 plus pounds off the floor. I'm just, or it's something close to that. It's very obviously very emotional for me to kind of see my clients' growth going from a place of like where they're doing banded clamshells, so like now they're lifting 200 pounds off the floor. But I'm just very glad to see that like you are telling people and admitting that things are not perfect nowadays. Like I still will have days where like maybe I mess up, maybe I'm more stressed, maybe I skipped a workout or two, and my body's not feeling good. You know, it's not feeling the best today. So I know I need to just level up my consistency more, or level up my knowledge more, or just get back in the gym, right? So many things. My baby right now, one baby, she's just learning to walk, and she's going through this like huge milestone of like her brain's changing, and you can tell she's waking up 3 times. You know, she just woke up 3 times this night, and so my sleep is shot. And I don't know if people can see the bags in my eyes, but there's things that are going to hit you in the face, things that you sometimes you're not prepared for, and sometimes you got to just either one, level up your consistency, understand that things aren't perfect. And I know you're not a parent, Jacob, but you know you will go through your own inconsistencies, and anybody that comes into this expecting that things are to be absolutely perfect is I think they're setting themselves up for failure. But to now say that you are at a place mentally, physically where you feel like you're in control again, what are maybe some things that you're looking to achieve health wise in the next 6 to 8 months, whether that's like an actual concrete goal, or whether that's just you just working on the process of just becoming better or more consistent? What are some of the things that you're kind of thinking about right now?
Yeah, no, I've thought about this question, and I think for me, it's more just like living pain free for hopefully the rest of my life. Maybe that's not realistic, but living pain free in the short, medium, and hopefully longer term. It's like I think I used to be someone that's like always on to the next big thing. What's the next mountain I want to go trek up to? I want to do another century on my bike ride. I want to do X, Y, Z. And I think right now I'm in a spot where I'm just mentally like, hey, be really grateful for, kind of practice a little bit more gratitude for your body. Be really grateful that you're getting through the day in less pain than you used to be. And yeah, get out on your bike, kind of enjoy the summer, do kind of travel, get out there and do all these different things. But I think right now I'm really content to just kind of be practicing gratitude for feeling good in my body for the first time in a lot of years. And yeah, I think the challenges will come. I think I'll want to get back on my bike and do kind of some crazy rides maybe next year or maybe later this summer. But yeah, truthfully, like right now, I'm just happy to feel really good in my body again.
Yeah, I'm very grateful for that. And practicing gratitude, it's probably another theme, another podcast episode. I have episodes about gratitude, about just the role of like it actually modifies your DNA. Starting off the day with gratitude is not just like a mental uplift. It's not just that, right? It's not just like people saying, "Oh yeah, be positive." There are actual physiological changes to actually practicing gratitude, secretion of oxytocin, keeping your body away from cell apoptosis, which is like cell death. So I'm glad that you're doing that, Jacob, because practicing gratitude and like starting your day off with gratitude, there are true physiological changes that change your actions, that change how your brain is working that day. So just very thankful that you were able to hit on that note. Just being grateful that your body is serving you well, and that if you were putting in the work, taking the failure, you know, being 1% better daily. Again, you know, more concrete things like tracking workouts and being brutally consistent and even working on that consistency long term, that's going to pay huge dividends in the long run. So I'm glad that the autonomy and independence and some of my crazy addictions for fitness have rubbed off on you to some degree. And
Definitely.
I mean, with that being said, I don't know if you feel like there's any sort of kind of like last kind of like messages for anybody that's listening, whether they've tried a lot of things or whether consistency has been a factor in their life. What are maybe just like one or two things that you can hit on? If you were teaching somebody over the past 6 to 8 months of like stuff that you've learned, what would be some things that you would teach to that person?
Yeah, I mean, I think the first, and yeah, we've talked about this, but I think the first is just like the mindset shift of making sure that you're the one in charge of getting yourself better. I think that's something that you always focused on is like, hey, I'm here, I'm gonna teach you what you need to know. But at the end of the day, like it's your life, it's your body, and you're the one that has to really be owning this process and
Mhm.
owning kind of it for the rest of your life. And that's not something that had ever been passed into me from other kind of physical therapists and like, okay, you're going to come in here, you're going to do these things, and then do the same thing at home, and then we'll come in the next time and we'll do it again together. But I think actually being like, hey, you're the one doing these workouts on your own. I'm going to help you, but like getting that ownership, and I think that's the mindset shift that shifted into kind of improving my mental health as well. Is like, okay, like this process is yours to control. I think was the biggest thing for me. But again, is like you're there along the way, and I don't want people listening to this to be like, okay, I'm going to be in the gym solo, and but I don't know if I'm squatting right, I don't know if I'm deadlifting right, I'm going to hurt my back, I don't know what I don't really know what I'm doing. But like you were there along the way. I could send you videos, I could send you a voice memo, I could send you whatever I needed to. Excuse me, to kind of get my message across and make sure that kind of you're there to really assist me in the process. And I think to this day, if I sent you something, I know you'd respond within a few minutes or a few hours. I know you got two young kids, but I think that the accountability there and just kind of your reliability was really important to me throughout, and kind of feeling like you were there to help me through the process.
Yeah. And yeah, as much as I have two young kids, I always consider my clients like, I always say like my kids and my family come first. My clients are pretty damn close second in terms of the care that I'm trying to provide. And yeah, again, we hit on autonomy, consistency, progressive overload, and I know that those things are like as long as you teach those things pretty well and you say to yourself, yeah, that you're in control, then I know that I'm pretty confident that you, Jake, can carry this on long term. And also, I mean, share the message, obviously, because
Of course.
there's so many people in the world. I think even in healthcare where consistency is not something that most healthcare practitioners hit on hard enough, nor even the progressive loading aspect. I know that there's a concrete, hey Jacob, this is how your hip works. Hey, your spine's doing this. Hey, your scapula is, it moves in these positions, so you can move it. I think those are all great, like tactical things that I've taught you. Like, hey, this exercise can help reduce your hip pain immediately. Oh, cool. That's cool. At the end of the day, consistency, autonomy, independence is probably the most important. I know I showed you what, like 40, 50 exercises during our time working together, but I could have shown you five. And as long as you're breeding consistency, that would have been fine enough for me. But obviously, you paid more for just more strategies on that end too. So in any case, yeah, Jacob, I just want to thank you again. I'm grateful for our time working together, the relationship that we built. I know that you're going to obviously continue to push far beyond our time working together. You're not just settling for the stuff that we had. You have some loftier goals. So, for anybody else that's out there that may be struggling with pain, look at Jake and look at other people that have proven themselves, that they were able to get past their pains and get past certain mental and physical hurdles. So, Jacob, thank you so much for being here again. And I know we'll keep in touch from here.
Absolutely. Thanks so much for having me.
All right, Jacob.